Alright, listeners, it's Ryan and Megan, and welcome to the Mental Health Mixtape, a podcast dedicated to fostering open conversations, sharing stories, and exploring a diverse range of topics related to mental health. So hold on to your seats as we sit down with some amazing guests to get their perspectives on the ever-changing landscape of mental health. And for all you old folks, no need to hit the record and pause button. Just sit back and let us navigate life's playlist together. During this podcast, you may hear stories about traumatic events and our guests' experiences. There may be discussions about suicide, traumatic events, and the outcomes from these events on personal lives. If you're struggling with anything you hear, please reach out to your peer support team, psychologist, call 911, or head to the nearest hospital. In Canada, you could call Boots on the Ground peer support for first responders at 1-833-677-2668. Talk Suicide Canada at 1-833-456-4566. And in the United States, call 988 for the National Crisis and Suicide Lifeline. It should be noted that the information shared on this podcast is for educational and informational purposes only and should not be considered a substitute for professional medical, psychological advice, diagnosis, or treatment. Welcome, Dr. Kelly Dean Schwartz. Just so we don't get that all mixed up. Thank you so much for coming on the Mental Health Mixtape podcast with Megan and I.
Thank you.
It's nice to be here.
It's good to be here.
I don't have as much history with you as what Megan does, and I think it's been interesting to get to know you over the last couple of months and see what you bring to the table and get to know you as a person. So, from me, I really appreciate you being here. I think from my perspective as a first responder, I can really appreciate the work that you're doing in the background. And for our listeners, really, it's the family side of first response.
Right.
And really, I think over my career of 23 years, that's been the biggest part that's been missed. So somebody like yourself that's actually bringing it to the forefront of, treating the whole family system is so important.
Yeah.
Because it's never been done before, I don't think.
Yeah.
So I think for me, the question I've always had is, how do people get to where they are? How did you get to here?
Yeah.
And we've asked this of many of our guests about what was the trajectory to get you to what you do currently?
Yeah.
And just like, how are you sitting in this room today?
Boy, that is a load. How long is the podcast?
We got as long as you need.
As long as you want.
Really good. Well, first of all, let me give you guys the thumbs up for doing this, because I think this is, the formal part of the work we do is so important. But I think having this conversational side of the work that we do for first responders is really important too.
Mm-hmm.
Like, I think that's what we also enjoy, especially Megan and I enjoy when we're talking with first responders, is getting to know their backstories and getting to know who they are and just like you said, how they got to where they are. And I like that question too, because I think that's, in fact, I'll circle back to that question on how families get to where they are. But yeah, let me start with, so how I got here was, I've been a psychologist now for over 30 years. Started here in Calgary, working in the school system with Calgary Catholic.
Mm-hmm.
Was a school psychologist for 6 or 7 years. So automatically, part of the answer to your question is, the thing that I was most surprised about was I thought I was going to be working solely with kids, and it turns out I was working as much with adults as I was with kids, teachers, administrators, and then of course their parents, these kids' parents. So that was, and I love that, because I always had, I'm going to geek out here a little bit, a love for Yuri Bronfenbrenner's bioecological theory. Does that resonate with you?
I've heard of it before.
Okay.
There's a small joke here, because Kelly can't have a conversation that goes longer than 5 minutes without bringing up Bronfenbrenner.
I feel like I should be getting some sort of.
Is there some kind of?
I wish.
Yeah.
I mean, I often joke. In fact, in like classes when I talk to my students, I'll be like, and I know they're not thinking this, but I'll say, "Hey, you're probably wondering if I have a tattoo or not."
Yes, yes, actually.
and they're like, actually, we weren't
thinking that, so no.
But they're like, so then when we get past that uncomfortable part, I'll say, well, if I did have one, I would literally, because Bronfenbrenner is famous for this concentric circle model where the child is in the middle, and then you have these overlapping circles around it, and then you have these wider circles around that. So all that to say, I can't even remember where I was going with that. But when I was working with yeah, when I was working with kids and families, that's always in the back of my mind going, I'm working with the child, but I'm also touching all these other areas of the child's functioning and existence. I left school psychology practice and took an academic appointment where I developed, interestingly, a Bachelor of Arts degree in family studies.
Okay.
So that then got me really into the theory mechanic side of family functioning, family systems. Loved that, and in fact, again, as I was training a lot of youth workers. So they were going to work at youth agencies, churches, places like that. So it was fun for me to think about the work that I was doing with children and youth, and then bring on a whole new generation of applied youth workers who were going to think about it differently through this Bronfenbrenner lens. Right? Did that for years, and always kept a private practice going, even though I had left the school division. Always kept a private practice going. And again, it's as much as I liked working with children and youth, I was working with the families as much as I was them. And in fact, the dark joke is that many of the kids that would get referred to me, it wasn't the kid who needed to be referred to me. It was that's because I'd meet the parents, and then I would go, okay, now this all starts to make sense about why this kid is doing X, Y, and Z in the classroom. And so, yeah, that brought me all. Then I've been at UFC now for 15 years. I've continued on in my research, again, mostly focused on children and youth. But we've always never forgotten, and in fact, at various levels, have always focused on family functioning within this. Like we did an evaluation of the Triple P parenting program for one of my graduate students. Did that. We looked at social media use or technology use of young children, and you can't do that without considering, well, what's the parental monitoring going on with all that stuff. So it's because, again, it's never, I shouldn't say it's never, it's sometimes not the child's problem. It's also how much the parent has no boundaries around their technology use and things like that. But then jump ahead to probably 2014. Found myself, I don't know if you want me to go into this detail or not,
but anyways, this is great. But
I think it's important though, because people need to know the why.
Yeah,
right?
Like you have some opinions and perspectives, and it's important.
So I was serving on a nonprofit board, and a colleague of mine on that board invited me to a True Patriot Love fundraising dinner, 2013. So I'm like, I'm not one to give up on a free dinner, right? I never wanted to say no to that.
The good Saskatchewan boy.
Exactly.
Uh-huh.
So, we can go back to the Saskatchewan rates too if you want, so I go to this dinner, sitting at this table, and immediately get drawn into the conversation because they strategically put lay people like us with military members and their families and stuff, and immediately got talking about what I do. And then these two military people just locked in on me and said, what are you doing? What's going on with families? Like, is there anything? And I'm like, I have no idea at this point. This is 10 years ago. So I leave that and I start to talk to a mutual colleague of ours, who was a graduate student of mine at that time, Dr. Andrea Stelnicki, and she was looking for a thesis topic, and we started to think about, military families. And so we mucked around in that for a few years, and did some pretty good work on military families, especially veterans who are transitioning into civilian life, so military to civilian transition. And guess what we found? That it had as much to do with the military member as it did the families really struggling with that transition, because some of them had been in service for
30 years.
Decades, right? Then that led into, the current stuff that we're doing now, because as we got into the military family circles, we realized there's a whole other area of public safety personnel that are doing similar but different work. And so we'll probably get into more detail on family stuff. But that's the story, like from earliest clinical work through my kind of interest always in family systems that led to thinking about military family, and now, into first responder area.
Mm-hmm.
So how did that collaboration with Megan work? So you gave some timelines there, and I know with the BOSS program, it was conceptualized 2016, 2018 was the first kind of like BOSS intensive.
Well, let me answer.
I was about
to say, let's see how she answers this.
Two get together as far as collaboration within the systems that you guys each separate.
I want to see what she says, because I have my own version of what this story.
So my recollection is that, and I can't remember exactly if it was 2013 or 2014, but it's around that decade ago time. I remember getting an email from this guy who said, I knew your dad, right?
Yeah.
My dad is a psychologist and had been one of your supervisors, right, at some point in time?
He taught an assessment course, and I think, and did some supervision for us within our, at that time it was called a school and community psychology program.
Yeah. Okay, so I get this email from this guy that I didn't know saying, I knew your dad, and here's what we're doing. And like at that point in time, I had just transitioned from the OSI clinic and was working in community practice. Like it was right around that time in my career. So I was doing a lot of independent work. I was just by myself at that time, I think. But working with military and veterans, and then general public safety. And so I asked my dad, I was like, who's this guy? Do you know him?
And he probably had, he was like,
stay away.
Either he had one of two responses. I don't remember him, or stay away.
No, but he remembered Kelly and had good things to say. And so I was like, okay, that gave me a little bit of comfort.
Mostly because I knew one of your dad's really good friends too.
Who?
Phil Eaton.
Oh, Phil, of course.
Who connected me with Woods, who then connected me with your mom.
My mom, that's right.
Yes.
And Phil's wife, Shannon, story, taught me to water ski when I was 8 years old.
Oh, boy. So this goes back way further than you thought.
I was about to say, there's a lot more history than I thought.
There's a lot of history.
To learn so much more about it.
There's a lot of history here. But anyway, so then Kelly and I sat down in with Andy, and she was doing her master's degree at that time, I think, and I just tried to help you with your recruitment efforts as best as I recall.
Well, I would add to that you were giving a talk at Mount Royal.
See, I don't remember this
And
talk.
we went, and I brought Andrea. I'm like, let's go here, because I know this person's dad, so she must have something to say about this. So we went, and then we talked with you afterwards. And then
I have no recollection.
Yeah, we'd have to look back and see what the actual date of that was.
Yeah. Well, I mean, I believe that I did it.
It had to be like 2014, because like I said, I went to this True Patriot Love dinner in 2013, and that's where all the wheels started to turn.
So then we had stayed in touch, and I had stayed in touch with Andy for the years that she was trying to do this piece of work. And like, I don't know, like I came to CPA at some point in time. So we just, anyways.
Oh, that's right. I brought you out as a guest speaker for that.
And that was a military event. So we just kind of stayed in each other's like orbit for a period of years, kind of helping each other with different things. And then, as you know, in 2017, I was working on building BOSS. And this gets a bit fuzzy in my own mind, but was working on that, and Kelly and I sat down and started talking about the idea of having something complimentary for the serving member, for the spouse. And it just happened in October of 2018 when we ran our very first BOSS group. Kelly actually sat in as
I sat in a live group.
To see what
one
it
of
was
the
all about. And that, I think we just kind of pollinated and started thinking about what some of those pieces might look like. And then from there's been a few revolutions and iterations and things happen, but that's brought us to having the program that we now have.
Well, and that's where I'd probably come out after every one of those sessions, and I'm sitting in your office going, you got these, 6 or 8 or 10 first responders sitting around, and so many of their responses were, oh, I wish my family member could hear this. I wish they were learning this. I wish. And I think the facilitator, I actually got in trouble a few times because I'm supposed to be this silent observer, but I'm rarely that, because I would be jumping in and going, oh, well, what would that look like? What would that? And of course, that's not on the BOSS curriculum, right? But it was just like they were just so, the appetite was already expressed in words and in emotion. Like they were just like, this is great for me, but what's going on?
Well,
here?
and you know this story, and I think you do too, but like part of where BOSS came from for me too was going to groups like the COPE program, so Couples Overcoming PTSD, which is offered through Wounded Warriors. and running those groups. And like we would provide just a high level of education around here's what operational stress is, da da da. And like within the first day, you would see this change and
Right.
shift in dynamic between the serving member and spouse, because they'd finally have some context and understanding for what was happening in their home. And it helped them to like depersonalize that struggle and actually come together in having like a shared,
Right.
challenge or task they were facing together. So it was really quite remarkable to see that happen.
Right. Yep. No.
I think from a first responder, I mean, that's been something that I've reflected back on. What if?
Yeah.
What if there was something a little bit more offered, at least anyway, from your program or something similar to help, anybody that's got a serving member. And
Right.
we had nothing when I started back in '99.
Right.
And nothing up until obviously now.
Yep.
Because I think that's what was missing. And some of the struggles I had at home definitely were probably related to a couple pieces, the trauma that I had at work, occupational stress injury, worked through some pieces of that, but bringing the lack of understanding of bringing work home and home to work.
Sure.
So I always thought that I could separate home from work. I put the dad hat on or the husband hat, go home, and all would be good.
Right.
And it wasn't. Right. There was times where it was, and it was all like we worked through some really hard times, but having that idea about what might have been,
right.
It's not looking back in retrospect and going, oh, I wish I would have.
Yeah, regretting. Yeah.
And there's no regret. It's just interesting now that we're finally getting to a point, I think, with the research and with all the offerings to really put together a holistic family program, not only for the first responder, which I think is super amazing and important, but for the family system on the back end.
Yeah.
Because I think children suffer, spouses, partners suffer, and it's a different kind of suffering because they're trying to hold space for the member that when they come home, they're walking on eggshells.
For sure.
Right.
And that's where, personally, I started to reflect, like again, in this mid 2015, 2016 era where I was meeting more military and first responder members themselves and just getting to learn what you guys experienced on a day-to-day basis and then comparing that with my levels of stressors and the things that would stress me out at home and that would leak into my relationships with all my family members. Comparatively, they were just so very different. Like my bad day is I didn't get a paper accepted, or a student's late with, an assignment or, so those are stress. Those were just the regular organizational conflict you would have too at the university level. But I was just struck by again from the military. This is where it was a foundational moment too, because we'd worked with military families for 3 or 4 years. And as you know, they go on deployments or they go on training exercises for months at a time. Mm-hmm. So the interest there in military, and still is, was the deployment and then the reentry back into the home. Like lots of stuff and conversation going on. But then it twigged with me is that first responders are doing that every day, 5 times a week. Yeah. They are deploying 4 times a week and re-entering 4 times a week.
Well, and they're living in their quote unquote combat zones, right?
Exactly. Yeah. So that was just like the lights just started to go on, thinking as much as we think we understand about military families and the dynamics that go on there. And again, I think there is, as you can imagine, the struggle of distance and time and communication, which are complicated, certainly adds to it. And then the whole military machine. But I think the micro version of that is still in our, emergent service areas, and so that's what really struck me was, is there anything we can take from our military stuff and apply it? And what do we still have to learn from first responder families yet that's going to inform whatever we might come up with in terms of interventions?
Yeah, and I worked in the downtown core in Calgary here for a part of 15 years. I can't even remember now. Yeah. But I live just across the river, which is part of the catchment area of my response area.
Right.
And that was I wouldn't say constant, but it was a very often a thought in the back of my head.
Right. Of
what if I respond to my in-laws that live very close
to
us? What if I have to go and respond at home or to somebody?
Right.
And I think that's what, we're, as much as we say, and I think we try to not really recognize that is a part of what we do.
Yeah.
Then it's daily. It's the daily grind. And
It
it's
is.
not the calls. It really isn't. Like for some of us it is, but I think for me it was the organizational pressures of doing more with less.
Right. Right.
Now how do we do that when you walk in the door and you get handed that little guy that you just had who's like 18 months old,
Sure.
your house partner's been at home all day, and we're not taught on how to reconnect.
Right.
You
Yes.
know, there's always just this transition back home because we've never
Yeah.
shown how to just take a pause.
Right.
Hey, I got to go do something.
Yeah.
I'll come back and reconnect. But how do we reconnect? Nobody's ever shown.
And that's what we heard. So I actually want to ask you about this too, because in our early military work, we did, the buzzword operational stress, but then we were hearing more and more from military about the organizational stress and how that was, especially for veterans who'd given, 23 years of their life to this, and then they move into the veteran sphere and they just, and again, this isn't going to turn into a VAC bashing but it's just, they just weren't prepared for how much stress was yet to come organizationally. Like their minds and brains and bodies had become accustomed to the stressors of the job, but now the stressors of the organization were incredible. And that was that was very interesting to me, that would be anything that we would address or need to address within first responder groups as well.
Well, it's interesting, and you can speak to this because I know you have more personal stories about this. But I mean, if you even, one of our colleagues, Nick Carlton, at CIPSERT, the Canadian Institute for Public Safety Research Treatment.
Trademark.
Trademark, yeah, exactly. We bring this into our leadership version of BOSS that we now have because the data is now, I think we spent from 2012 to 2018 or 19, I think, really focusing on the needs of the serving member.
Yeah.
And then increasingly in the last 3 or 4 years, the stories that have been heard in clinical practice are now showing up in the empirical data, which is, the calls are significant, but it actually is this organizational pressure,
right? Whether
it's leadership style, whether it's bureaucracy, whether it's legislative changes, like whatever it is, but it's these organizational stressors that really are the culprit, I think, for a lot of people's emotional stress.
And isn't it the organizational deafness too, in some ways? Like they just weren't attuned to what their members were experiencing and weren't responding to that.
Well,
I don't know.
I think they are, because they all got promoted from within.
Right.
So
right.
Most of the rank and file on the front
should have known that, yeah.
And as they move into leadership positions,
right,
they do have an awareness of the busyness, the calls, the stuff, and all the barriers and roadblocks that are in place at times.
Yeah.
I would really, really be interested in finding an organizational leader that has not been promoted from within.
Sure.
Because I think those, and again, we're not here to bash people, but I think it's just this, all the people that are in leadership positions, from my perspective right now, have all been promoted from the street time. And back then, the stigma was rife.
Yeah.
Right?
Yeah.
Pull your socks up, put your boots on, go do another call.
Pseudostosis.
Right.
Yeah.
Right.
And it's like nothing is going to impact my leadership.
Sure. Sure.
But I think we're starting to see this interesting shift where the organizational issues are actually more impactful because we train to do our job.
That's right. Yeah.
And we're trained very well
Yeah.
to functionally disconnect, if we're going to throw some boss terms around.
Yeah.
Right? Functionally disconnect. Nobody's shown us how to reconnect, number one.
Sure.
When we go to the calls, I think there are impactful calls. There's calls that I still remember that I've worked through. But I think what ends up being missed is the understanding of all of the other organizational barriers. So a good example that I've used in the past is when people go off and they're trying to navigate the landscape of supports on the outside. So they're off work. They're trying to and they're going through treatment. They're doing the hard work that they need to do to get well. But yet there's other organizational barriers that could probably have been handled better by the organization, like workplace health and safety, workers' compensation boards, trying to fight for paychecks. Why are they not getting paid? It's all of the other things that I think the organization should probably take on a little bit more. So that they can support an individual so they can work on what they need to work on.
Sure. Yeah.
And I think most organizations really need to kind of figure that out.
Right.
Because as we move into more awareness, more people will be more apt to put their hand up and say, I need some help.
Yeah.
And then if they're just met with those organizational barriers, I'm not an expert, I'm not a clinician, but sanctuary trauma is something that's always talked about when people go back to work.
Yeah. Yeah. And again, you're making me think, lost in this mix is the spouse or partner or family members who are going along every stage of this and probably really thankful for the increase in emphasis and resources of mental health for persons, but they're probably still going, what about us? Because now, dad's home now on a 6-month leave. Well, that doesn't just automatically make anything better. In fact, if anything, that changes the dynamics of that family system.
Especially if they're in 5 days a week treatment.
Totally.
Well,
yes.
and I think we've even heard recently, like I know that I was told, now it's 8 or 9 years ago now, but I mean, I certainly was told not that long ago, we don't want to tell our serving members the kinds of things that they might confront, because then they won't want to do these jobs. Like that was absolutely the attitude, right?
Huh.
I think that's shifted significantly. We see that. But I think even we're still hearing that a little bit for the spouses. Like we don't want to scare the spouses. We don't want to scare families. So we're just going to kind of hold some of these things in reserve. Yeah. So, I mean, we clearly still have work to do.
And we've met through the course of our research and the program that we're doing now. We've met, and it comes out anecdotally sometimes, but those that knew that their partner was going to be in the first responder occupation, and then those that married into it or coupled into it, like, and they go, I had no idea. Like, I think it's one thing to step in together. It's another thing to join up with this person when they're already in it, and be really blindsided by the intensity of it and just the unawareness of all the things that can go wrong. Yeah.
There's a piece of that, that idea that don't share with your spouse the calls that you did.
Right.
Which really kind of translated into just don't talk about it at all.
Right.
Right. So when I started my career, it was like, why would you tell your spouse that you had a rough day and then potentially tell her to call?
Right.
The call.
Yeah.
And I kind of took that to the nth degree.
Yeah.
Until I figured out that actually talking about it, or at least giving some perspective of where I'm at in that moment.
Yep.
Right.
Figuring out what I needed to do to actually regulate.
Yeah.
And then move back into that.
Yeah.
And I was very fortunate that my wife actually came along at the beginning.
Right.
And it was a conversation back when we first started in, like, hey, this is kind of like the career path.
Yeah.
Are we aligned? Like, are you willing to come along? And here's what I know is potentially going to happen.
Yeah.
And thankfully, we've been together for.
Yeah.
I don't know. I don't even want to say because I'll probably get it wrong.
Yeah, you don't want this. Don't put this on recording.
Yeah, married in 2001. Been together since '99.
Okay.
So,
that's a long time.
Yeah. She's come along the entire way, and thankfully, she's vulnerable enough to say, get your shit together.
Yeah.
Which was good because I think I needed some of those pushes along the way. But I think the overarching theme behind when I first started was just don't talk about it.
Sure.
Well, and I think what's interesting too, and I mean, you should talk. This is your interview.
No.
We should
it's a conversation.
We should talk about the Rebuilding Families program soon. What was I going to say? I think what we are seeing is that finally the empirical data is catching up with what we know and hear anecdotal.
The anecdotal,
right? So like that thing about it's likely going to be someone's spouse or partner who's going to say something's not right here and you need help, right? And in terms of help seeking, you're much more likely to go to your spouse or a peer than what did you call me the other day, Dr. Bonkers? That was lovely.
Oh, that's endearing.
We were teaching the other day.
That's the language we use as first responders. Why would I go see Dr. Bonkers?
Oh, so it wasn't you specifically. It was just you in general.
Felt a little specific, but
felt a little personal.
But it makes sense, right? Like, people aren't likely going to go directly to a mental health professional, or certainly maybe to a leader if they're not feeling comfortable, right?
Yeah.
And even now, nobody's going to go to a leader.
Yeah.
Thank you. Do you see that?
I do see that, and I'm going to try.
It's just like there's a ray of sunshine just bouncing off your head. That's perfect.
Like they're never going to go to a senior leader. They may go to their immediate supervisor if they feel comfortable enough, and that leader is actually showing kind of that vulnerability around have conversations. But even within the organization I work for, there's no leadership training. You're just fine.
Well, and I was just going to say, let's stay on the professional side, because here's where I go back to work with military and then early work with first responders was when they were open. And they're like, again, I think the Bell Let's Talk and all the stuff like that have really helped to make it's still, I still don't think it's entirely accepted, but we're more aware, right? The awareness level is really high. But then you hear, and we hear this from military all the time, staying on the Dr. Bonkers theme, was, which I kind of like that. That's really good.
We should call this a mental health mixtape with Dr. Bonkers.
Yeah, exactly.
I know when that came out of my mouth the other day, this was going to come back.
Oh, for sure. This is going to repeat for a long time. Yeah.
But they would say, look, I've gone and sought help, and I'm on my 6th psychologist because I'm traumatizing every professional that I go see, and they're not prepared. And here's where now I go back to put my training hat on and go, we're not training like I'm training more child and adolescent youth psychologists, but even in the field of clinical or counseling psych, we're not training folks to deal with the heaviness of what's coming out on this. And so this is where I look back on my own field and go, we've got work to do just even on the training end to responsibly provide care to first responders, military, frontline medical staff, because there's a level of need and a conversation level there that is just not typical of what we're training in our regular programs.
Because I think you run the risk, if, and I heard it time and time again in my previous job, is I tried our insert whatever, we're not here to bash anything, but I tried to go to a generalized counselor and they ended up crying, or they ended up responding to the story. Because once we feel comfortable, say 2-3 sessions in, and we start to feel okay to open up, that's Pandora's box literally opening, and there is stuff and shit that's going to come out that people are not prepared for, I think, unless there's a little bit of cultural competency in the background. Because I've heard that. I went, they cried, I won't go back because I don't want to injure the psychologist. I've heard that. So that's kind of an interesting place where it's for culturally competent clinicians, that's a hard thing, because how do you get cultural competency?
Totally. Well,
and I think it, I'm just sort of reflecting on that for a second as we're sitting here, because we're talking about families and spouses. It's unfortunate, but you almost create another almost like subspecialty when you're then talking about working with families and couples, right?
True.
Like I do a little bit of couples work, but not tons. Right. I don't do any work with families.
And
so I think the culturally competent therapist to help a PSP family.
That's a whole.
That'll be the next iteration, though. I think is that we have to start going back to it always comes back to Bronfenbrenner, right? Thinking about the circles touching is that we can't just think about the individual anymore. It has to be the systems that we're touching. Yeah, for sure.
So what have we built? What have we done?
Yeah. What is this?
What have we done?
Thing that you're doing.
Well, so I remember clearly Kelly and I sitting down, and it must have been 2017. I think it must have been maybe it was the winter, spring. Anyways, it was around that time. But I remember clearly sitting down. We were in our old office, and you and I, our knees were practically
in the little house office.
In the little house office, right? So small, starting to kick around. And originally, we were going to call it Boss Family.
That's right.
Right.
That's right.
And that changed. So when did we get the CIHR grant? I can't even remember now.
So, we started talking in 2017. I probably sat in on the BOSS program with one of your facilitators in 2018. Were you offering it by then?
Yeah, we were. It was the fall.
In the little house.
Yeah.
So I went, so that's where I went. And then a notice for letters of intent came out in early 2019.
When did we go to Regina to do that?
That's what I was you're right. That's what I'm just thinking. Was that even late 2018?
I think it was 2018. I think we went and pitched that thing.
So anyways, long story, very short. We were chosen, 18 applications were chosen from this letter of intent.
From the Canadian Institutes
of Health Research. And we all, I forgot about the Regina trip. We all went to Regina, did our little 5-minute pitches.
Yeah.
And then we went back and wrote our full proposals, and they chose 9 of those from that 18. And they were all, they're all strong proposals, all different parts, like everything from occupational therapy and physical therapy and, but ours was one of the few that had to do with either either mental health, and one of the only 2 that had to do with families.
Yeah.
So we wrote that grant. I just remember because it was around my dad's passing right in there. We wrote that it had to be in November of 2019. We got through winter of 2020, and then this little thing called the global pandemic happened. And on March 30th of 2020, we got notification that we got the $1 million grant. to do and the focus of all the grants that were funded, all 8 grants, the intention was that everything that was done needed to be in support of, in better language than this, making the first responder stronger in their job. Mm-hmm. And the angle that we took was building a stronger family makes for a stronger first responder. Now, I don't want your 6 listeners to mishear.
Mom, don't get riled up about this.
To hear a causal connection there that we think making a stronger family makes a stronger first. But it comes back to that family systems issue, is that if we can touch, because now BOSS was in motion.
Yep.
So that part was, there's some other unmentioned programs that were available too for first responders that you could go through, like some mental health first aid training and education and things like that. But we were coming at it from the angle of, okay, if the first responder has these resources, we wanted to create something that was very much like, so yeah, we did internally call it BOSS Families for 6 months or more, right? Yeah. But it was, so we, now it's a blank, right? Because now COVID hits, so we spent the first 6 months just doing lit reviews, getting in on the literature, finding out what had been done, what hasn't been done.
And this is a whole team of people.
There's a whole team of people.
Together, primarily from the University of Calgary. I think, am I the only external person?
Yeah, so your role, just for the record, is as principal knowledge user. Because all the grants had to have a knowledge user attached to the, and couldn't be a faculty or an academic member.
Right.
So you're right, we had a team of people, other psychologists, social workers, other people from other faculties and fields, lots of graduate students. We hired a postdoc early on in the process. That light is really, it's like you have a halo for your head too.
I know.
It's nice though.
Lock ourselves in here. This is my usual day.
That's good.
No sunshine.
No sunshine for you.
Sunshine. Yeah, exactly.
Okay, so anyways, the first year was lit reviews. We did focus groups. I've probably blocked out how many I did, but like coffee nights, pizza nights with first responder family members. I remember driving to Red Deer and meeting with the crew up there, and we got together and we bought pizzas and just had people sitting around. And I was just literally asking naive questions like, how are you guys doing? What's needed? If we were to build anything that could be a support to you, what would that look like? So we ended up with, a pretty wide gamut of things. And then slowly over time, it just started to narrow down to the point where we built and piloted in May and June of 2021, because we're in 23 right now, 2021, piloted a program and almost just handpicked some first responder family members to come and do it. But the reaction was just like, this is really like, and here's where I have to kind of, just cool my jets a little bit, because I'm like, we could have presented anything and they would have been happy, because they're just happy that somebody is giving families of first responders any attention at all, right? Like they had informed this, and so we did it. We refined it. We spent the whole fall of 2022 rewriting the program, and then so you've already given the title for it. So we called it Rebuilding Families.
Building
Families. Which I'm sort of regretting now, because people are like, well, you think first responder families need to be rebuilt? Like we're just that broken, right?
I actually love it because it's a play, right?
It is a play on words, right? The re is, from the Latin, which is all about, and I should back up and say, a year to that, we needed to come up with a handle for our group and for our project. So we called it Family First Responder. Yep. So the overarching project is called Family First Responder. That was really intentional too. We wanted, no matter what term we came up, we wanted the word family to be the first thing in it. So that anybody that we talked to, they knew that even though we were talking about first responders, that our focus was on the family. So then out of that Family First Responder project came what became known as Rebuilding Families, which the word re is just meaning all about or pertaining to. So everything we do is about rebuilding families.
Yeah.
So yeah, we've built that. We got together for 2 days and rebuilt this program, took what was working, added what wasn't working. And again, always, just to go back to your stuff too, Megan, was we did move away from calling it boss families. I think just because we wanted it to have its own identity.
Yeah.
But we used and referenced and tied to a lot of the boss principles within our program.
Yeah, we've bridged a lot between, particularly the functional disconnection, reconnection. We've built a model of that and some of those stoicism pieces. We've really...
And the stress effects on, not as much as you guys go into in terms of the neurological impacts, but we do talk about that in our program a little bit.
Yeah, so they clearly relate to one another. Because, to jump ahead to where we are now, even though there's more development that's gone on, I think, I don't want to speak for you, but we've had lots of conversations, and I think we both share the perspective that upstream training for the serving member is an essential component of a mental wellness plan for a first responder. As is and should be a best practice, upstream training for the spouse or family member.
Right.
I think it creates common language. So if we're talking about
this is totally what it does.
Spouses, partners, the idea of what's going on neurobiologically when occupational stress injury is starting to form.
Yeah.
You can and tie those into some behavior pieces, which it is.
Yeah.
Then there's a better understanding, and if both are talking the same language, and the spouse comes up or partner comes up and says, "Hey, I'm noticing these things."
Yeah.
And if we remember back to your boss training and my training with the family first responder, this is where are you at? And it opens up at least a common language, which I think if I put myself back 10, 15 years, there was times I had no awareness around what was going on.
Totally.
And if there's that common language, I more than likely probably would have leaned into it a little bit more and tried to figure it out versus just go, whatever. Which I think is a common reaction amongst most first responders.
Sure.
No, I'm good.
Yeah,
yes.
Totally.
Because good and fine are never good, and it's never fine.
That's a question you should always ask twice, right? How are you doing, right? Because you'll never get the polite response first, and then
I'm doing good.
Yeah.
Really?
Yeah. No, really. Yeah. But it was, and again, we had originally thought because we're now just to make sure everybody understands, we're in the feasibility study version of this program. So we're testing this to see, does the format work? So right now we offer it in 2 forms. It's online facilitator led with 6 to 8 other spouses in a Zoom room. They go through a manualized 6-week program. They touch on 4 main elements of our program that I can talk or not talk about, but it's not only the material, the psychoeducation, but they're also getting the mutual support from the other spouses. And the other version is just like BOSS. We have a self-directed version, so it's just psychoeducation, weekly on self-directed. Video-based. Yep. So all of our stuff is video. All the materials are the same, no matter whether you're in the facilitated or the self-directed version, because it's all video recordings, and they go through a workbook, and we prompt them to reflect and answer questions and think about and journal and chart activities and think about strategies and all those sorts of things. So no matter which group you're in, we're doing that. But back to what you were saying too, we had originally thought in our original model, this was how close BOSS and the Rebuilding Families program was going to be. We actually thought about, do we just include members first responders who've done BOSS, and just have, go after, because you used to have hundreds, if not thousands, still early on, years ago. And we thought, should we just go and recruit from that group to see if it makes a difference whether or not your spouse has gone through BOSS or whether they've not gone through BOSS. We abandoned that.
That was going to be a little bit too complicated.
We abandoned that.
Yeah.
And we just felt like, at the same time too, especially if we were just going to include those who went through BOSS, we didn't want to exclude a whole sample of people who
100%.
hadn't gone through BOSS either.
Yeah.
But let me tell you one story anecdotally that was, so we were about, we started we started the full iteration of our Rebuilding Families program in February of 2023. So we're 10 months in right now. It was about in June or July. We we deliver workbooks if they want hard copy of workbooks. So I was like, I looked at the address, I'm like, oh, this is like 2 communities away from my house. Mm-hmm. So I'm going to drive this workbook to the spouse who wants it, who's in our program already, but she's like, I want a hard copy of the book. So I'm like, well, I'll just drive it. And of course, I want to just sneak up to the house and literally like be an Amazon driver and ring the doorbell and then flee. Yeah, like I don't necessarily, because I don't want them to, like, I want to respect their anonymity and their, well, sure enough, I pull up to this house and what I assumed and what was the husband is out unloading a U-Haul truck in front of the house. I'm like, oh, shite, now I actually have to go and talk to somebody. So I get into my car and I go up and I was like, hey, is this so-and-so's house? Like, I'm here from the University of Calgary. If I'm at the right place, she's in our Rebuilding Families program. Well, he just immediately warms. And then he goes, well, I won't tell you which service area, but he's like, I'm a service member here in Calgary. And she, and we're only like 2 weeks into the program at this point. And he's like, this has totally changed the conversations we're having already. And he says, since she started this, I've started the BOSS program. So now we've literally got the perfect poster couple, because we've got her taking Rebuilding Families, the service member taking BOSS. But it was just like, and so we talked for 10 minutes. He's just like you were saying, Ryan, it's giving them the language to use and the comfort and just the opportunity. Because yeah, you don't want to come home and talk about your calls all the time. But when you're both going through materials that is getting you to think about how operational stress and the load is infiltrating the home, and now we're giving them the tools and opportunities to have it, he was just like, now it doesn't feel forced either. Like, now it doesn't feel like we're asking the questions or talking about this only when we get to a critically high level or an acute level. He's like, already in the last 2 weeks, we've just been having natural conversations about it. So that was just like, no matter what other data we collect, although I want to reinforce that we're going through great pains to build an evidence base for our program, that in and of itself was just like, that's exactly what we want to hear. That's exactly what I want to hear.
Well, and I think too much about probably 50% of the people that I have worked with over time have ended up in relationships breaking down.
Yeah.
And I do wonder, right? Like, is there going to be some way that some of this intervention or this education is going to help people?
So it's interesting. So now we've started to track, I think I mentioned this, we do pre, post, and then 3-month follow-up testing. So, we've only had we've only had 30 spouses go through our program all the way from pre, post to 3-month follow-up, because and then we'll have more and more finishing. But interesting you say that, because we actually see the healthy things taking a little dip post-program. And then at 3 months, they start to climb back up again. And I think, like, clinically, that sort of makes sense, because we're poking and prodding stuff that is causing them to think more deeply, which could be causing some difficult conversations to happen amongst these spouses, right? And how they navigate those and how they work around those. And we'd be really concerned if the positive things were getting less and the negative things were getting higher. But what we're seeing is that it's curving back around at the 3-month level, that it's taking that long for them to process it and think about it. We give all of our, I think just like BOSS, they have access to all the videos. They can go back and rewatch stuff. They can go back and look at stuff. So we're hoping that some of them are doing that, because it's just like anything else. We feed them from a fire hose during the sessions. It's a lot of stuff. Like, we're giving them a lot of concentrated material, and I think it just takes a little bit of time for them to process that and let it settle within their relationship functioning and things like that.
Knowledge translation.
Yeah. Yeah, it takes a lot of effort to do that.
It's interesting, because that's actually, it's not exactly equivalent, but it's not dissimilar to what happens in BOSS. Like, even in our focus group data, we have people like, kind of in some ways I'm a bit worse because I'm looking at things, right? Yes. What's happening. And, like, the ways in which I'm being taught to think about this and work with this is now helping me.
Yes.
Right?
Yeah. I mean, they're thankful for the material, but it has an emotional investment and cost to it. It really does, and a relational investment and cost to it. Yeah. So it's, but we're confident. Like I said, the preliminary data we've got, and then as we add, as more and more groups finish and we get that 3-month data, we are seeing the trend that it's actually we are, and that's great that we're seeing 3-month improvement. Be great if we were doing even another 6 months or something afterwards to follow. But again, I want to reiterate too that our program is very much prevention and early intervention. Right? We're working with spouses that are in police, fire, and paramedic families they're not acutely in distress, they're not in crisis, they're not incapacitated. In fact, one of the criteria is that the member of their family who's a serving member, police, fire, paramedic, can't be off work, which again, as we talked about, that's a big disruption to a family system. So we're getting a band of people and spouses that they're saying to us that they're functioning, but they're starting to feel the stress. They're starting to feel the weight of this on their, and this is where we focus so much on too, is part of the program is it isn't just about learning to be a better husband or wife to your police, fire, or paramedic member. That'd be almost
invalidating.
Yeah, that would be one of the most, distancing things we could do we want them. In fact, one of our last sessions is about identity, and we talk about the positives of being part of a first responder community, but also the positives of having your own self-worth, your own identity, being able to separate with that.
You should have Tracy take it.
Yeah. And that's interesting because I think for so long, I wore my uniform as my identity.
Right.
I will 100% admit that.
Right.
But as I transitioned through my career, later stages of my career, when I was off the street and doing some more mental health support side, that became less and less.
Right.
And I think there's this idea from first responder culture is that I can't be friends with people outside my service,
right,
or outside the PSP because they don't understand.
That's right.
And that leads to the identity piece that you identify only as
that's right,
whatever service member you are. And I was there, but I think I'm more healthy now because it's not that I don't have associates or people that I talk to from where I used to work.
Yeah.
But I've built more healthy relationships.
Yeah.
And more inclusive relationships outside of the organization.
That's right.
That probably are way more healthy and better and more beneficial for me as a human.
Yeah.
Than keeping those, because we just get into the one-upmanship.
Totally.
It inevitably will distill itself down to the calls that we did,
or the one-downmanship. Yeah, you just keep right.
Mm-hmm.
Yeah,
well, I did this.
Exactly.
Right. Inevitably, that's what will happen. And I think that's dangerous. Although we all do it, I think that's just a dangerous place to get to, because then all you're doing is just revisiting all of the trauma that everybody has and commiserating, and just it's not healthy.
And I think you're making me think that where I first got this idea about the identity struggle that goes on in first responder families is back to the military, where military, they would retire, because a lot of military leave when they're early 30s. They're not the 35-year veterans anymore. But then you'd hear from the spouses and partners going, I don't have any friends outside of and again, keep in mind that 20 years ago, there's a lot more people living on bases. Now they're more spread out, but they would still say, my community is this. And so I wasn't surprised to see that that's sort of the same thing within first responders, is they get tight, which is and I want to emphasize that our program, the Rebuilding Families program, is as much about endorsing the strengths of first responders families as it is about saying, here's some things that we know you guys can and need to work on. Yeah. And one of the strengths is the tightness of that community, right? Like it is a network that very few other people have in their lives, with the same intensity and with, like you said, the same knowledge base. Like you don't have to say anything, kind of what that family's going through because you've gone through it. Even if it's the irritations of shift work and all that stuff, nobody questions that. Like they're just like, yeah, that's just the way it is, right? Yeah.
I remember, so this was like 2016, something like that. I ran a COPE program. It's just stuck with me, and I just remember being so touched by this. We were running a COPE program. We were in a group, and it was the first public safety COPE we had ever done. Huh. And so it was all police and fire and whatever. And there was a police officer and his wife in our group. And I think on the 4th day, so it's a 5.5 day program, and I can't remember exactly how she put it, but she's like, they do this like relationship review where they talk about important things that have happened in a relationship, and they share that into the group. And she just talked about how, she says goodbye to her husband every morning, knowing that he could die that day.
Mm-hmm.
And I just remember being like so stopped in my tracks by that, that's like a living reality.
It totally is.
You don't know that.
No.
Like, I don't live with that.
No.
You don't live
No,
with
our
that.
spouses don't say that when you and I go to the office.
No.
Like, right?
No. They worry about who we might run over. But,
yeah, that's true.
But yeah, like it's just such a thing to have to hold.
It is. Yeah. And there's a lot of trust that goes within that says, you have an appropriate level of concern, but then you don't want that to turn into paranoia or anxiety or
incapacitating.
Exactly.
Yeah.
Right. Because, and again, this is going back to the spouse's perspective. What we heard them say is they're really proud of what their serving member does in the community. Interesting though, and maybe you guys have talked about this, or we'll talk about this on future ones, is the 3 service groups, police, fire, and paramedic, though, there's very unique identities with each of those too, right? I remember sitting at a pizza party with a group of police spouses going, we don't tell anybody what our husbands do or what our wives do. Like, we don't want anybody to know that. Whereas fire people, they want the sticker on the back of their F-150, right? And it says, I'm part of a fire family. And then as soon as you hear about paramedics or EMTs, they're just like, well, you're the angels that swoop in, right? But maybe you don't feel that way about it.
No, and I mean, that's the perception, right? I mean, part of the things and some of the struggles I have is inevitably in any conversation with anybody new, when you say what you do, they will always ask this question in a roundabout sort of way.
Right.
What's the worst thing you've ever seen?
Right. Which that's funny you say that, because that's the first thing I say. I know I will never say to a first responder. And
it's not because they're,
even though I want to, but
it's
I
not
won't.
Morbid curiosity. It's just, I think that there's this idea that, all the things that we do is we save lives.
Right.
And there's this, it's funny, a tongue-in-cheek narrative that we don't save lives, we prolong misery. Right? I've heard that more.
Yeah, right.
But I mean, I think that, yes, there are opportunities as paramedics that we really can make a fundamental difference in an outcome for a patient, because we get to them when we can, and we get to them first, and we take them to the place they need. And I think we minimize that.
Right.
Because the bulk of what we do isn't the life-saving, but we train.
Yeah.
All of our training is for the 1% of the calls we do.
Totally.
So we really don't see ourselves as lifesavers.
Right.
Everybody wants to know the worst calls we've ever seen. And you're like, oh, I don't really want to. Oh, come on, it's not that bad. Like, if I tell you these things, you'll have nightmares.
Right.
Right. Like, I don't feel I want to relive that.
Yeah.
But inevitably, I got to the point one time where I'm like, okay, here we go.
Right. You're making me think, and again, Megan, this is where we'd have to go back and check your Mount Royal College date. But, and I don't want to bring this.
I'm like, wait, well, that was awkward.
I don't want to bring the party down here, but I'll tell you the time when I had the most visceral experience was when we had that stabbing in Brentwood with the students.
Yeah.
Mm-hmm.
And I was just like, that's when I was, of course, most immediately affected by the fact that these were university students in our community, in my community at U of C. But then my next thought was, what did those first responders just witness and experience that's going to change them for the rest of their lives? And then, of course, the byproduct is, how is that going to change them and their families, right?
Yeah, that call is still rippling.
Isn't that something,
hey? The community, within policing, within fire, within EMS, and I mean,
within Crown prosecution.
Crown prosecution.
Is that right? Hey?
Yeah, there's a whole bunch of different perspectives that I never saw, right? The ripples and the effects of that. I knew there was all of the effects because I was on the peer sport team at the time.
Yeah.
Right or wrong, we did the best we could to support the people, but yeah, you're exactly right. I mean, talk about 6 degrees of separation. There was people there at the party that were directly related to people we knew, and it's and that's not even at work. Right. That's not the work connection.
Right. So
I think that's what we need to understand, and maybe the listeners and whoever's listening to this can really understand, is that we really don't know the impacts of anything that we do in public safety and the ripples and how it touches lives. And we really need to bring that to at least acknowledge that those ripples impact our families. They
Right.
impact friends of the family. There's potential that it touches somebody we know
That's
who
right.
was there.
Yeah.
And we really have to kind of just open up our awareness to that, because I never saw it that way.
Right. Right.
You know, I just looked at it from a clinical perspective. You go in, you walk in, you do your call, you do your job. That's amazing. You got them to the hospital, and then dust your feet off, clean up. And
well, again, so this is why, again, I keep coming back to, I met one of the paramedics that responded to that call, and they had to go. They were back. Something happened with shifts, and one of them thought they were done that shift, and they actually had to continue on for another 4 or 8 hours after that. And I was just like, how can we, humanly expect somebody to function, let alone function in a professional way after they've experienced that? Yeah. Which again, I'm just like, that's just the difference. That's what intrigues me and brings me back to, again, how this, like, I never set out, going back to your first question, how did I get into this? This wasn't, at 21 years old as a psych grad, I wasn't thinking, man, I can't wait to work with, complex families and things like that. And yet I come back and go, this is such a unique group to work with, because, like I said, they have undeniable strengths and they have undeniable stressors that they're dealing with. And so that's the challenge, is to bring those two together in some ways, is to applaud and fortify the strengths that they do have, and then to help them nurture along, some growth areas that maybe they haven't thought about, or maybe they thought about and they don't know what to do about it. That's where I think, again, some of our programs are really, and again, I don't want to give any impression that the Rebuilding Families program is the one-stop shop. It isn't. It's kind of the first step to get the wheels turning, to talk about communication and boundaries and identity and things that are really important that we heard from families, and to give them that.
Yeah, and I think that's what we'd say about BOSS too.
Yeah, exactly.
There's no way that you take BOSS, you're going to be immunized against the effects of stress for your career, but it's one piece of it, right? And that's I don't know, I can never come up with how I want to say this, because I haven't figured out my own head yet, but like the notion that it takes a village to raise a child, right? There's a play on this for me where it's like, our first responders, public safety, whatever, they're taking care of our villages, and like therefore the village needs to like somehow
support them.
Do you know what I
for
mean?
Sure.
Like, because it does take a village, I think, to help a single public safety member and their family get through to the end of career still intact.
Yes.
But there has to be a vulnerability within the organizational structure that understands that concept.
Yeah.
Right.
And without that, we as a, I think, a profession from first responders in general, really minimize the work we do.
Yeah.
It's, I can't, there's one example where my partner and I did a cardiac arrest, and fortunately we were able to bring the individual back, got him to the hospital, and, it's kind of like, okay, we're done, clean up the truck, we're back out on the road. Yeah. Because that's what we train for. That's 30%.
Yeah.
About a year later, we're going to get coffee in the East Village, and we were just walking in, and this gentleman was sitting with his wife and his daughter, and I didn't recognize him. I mean, I typically remember patients that I've seen, and he's like, "Excuse me," and I said, yes. Like, kind of curious. I'm like, "Yeah." He's like, "I just want to thank you," and I'm like, "For what?" He's like, "You saved my life last year."
Wow.
And it was one of those ones where I'm like, no, and I remember catching myself. I was just like, I almost said I was just doing my job.
Right. Yeah.
And he was like, "I can't believe what happened." And his daughter stood up. She's like, "Can I give you a hug?" The wife stood up.
Yeah.
She starts to cry, and I'm like, awkward.
Yes.
Me, because I'm in uniform. People are saying thank you, and they're like, "Can we buy you lunch? Can we buy you coffee?" It's like, no, I'm good. Thank you very much.
That's gonna make me cry. That's sweet.
Right? So there's this idea, I think, overall, is that when we get thanked for the things that we train to do.
Yeah.
I mean, for me, and I won't speak for everybody that's listening potentially, but I think that there's this, we minimize it.
Yes.
Yeah.
We're proud of what we do.
Yeah.
But we really minimize the impacts that it has on people.
Right. Yeah.
And we have to learn that, when we look at that idea that the village needs to help the community, that means when people, we have to be willing to receive that.
Yeah.
But we also have to have that ability for, pressure with our MLAs to do more.
For sure.
We have to look at this from a different perspective, which I don't think we're at the point where we're going to be able to do that.
Right.
Oh, we're getting there.
We're getting there.
There's some, because I'll get on my soapbox for a second. I mean, this is a national issue, right?
Yes.
Like, this is a federal issue, and
It's a world
obviously
issue.
that gets,
Yeah.
yeah. I mean, yes, it's a world issue. We'll tackle that in a second.
Oh, darn.
We'll deal
World
with
domination.
Canada first.
That's the next podcast.
That's the next, yeah, exactly. That's exactly it. But no, I mean, it is a federal issue, right? Like, this is about the safety and well-being of our communities, and as much as that translates down to municipalities and provinces, whatever, like, the advocacy that's going on is really to say this is a totally different kettle of fish than, sort of just general issues that the typical Canadian is facing.
Yeah. And not to say anything positive came out of a global pandemic, but it again highlighted the need for emergent services and how valuable those are when the whole system is threatened, right? Mm-hmm. And again, I think it is easier to talk about. I think, one of the things we still struggle with, even with our program, is we're getting buy-in from leadership of all the service groups, but we're still having trouble getting it down into the families, right? Mm-hmm. Because you still, going back to your talk about organizational, nobody likes stuff that comes from top down, or where we're a little resistant to it. But we're at least finding that there's not only openness to it, but they're like, we'll do our best to get this too. But then it still comes to the individual service member who reads it and goes, yeah, I don't, they're still the one that's the roadblock between them and their spouse, partner, family member getting this information to be part of our program.
Well, now I'm going to get on my soapbox.
Yeah.
We need to get this into schools. Recruit systems.
Yeah, right.
Yeah.
We used to do a recruit night with previous organization I worked for, like previous, where new recruit classes, they would have a spousal night.
Right.
And that spousal night was, hey, come on in for a dinner and learn a little bit about what your partner's going to be doing. It was like 2-3 hours. We served dinner from a peer support team.
Yep.
Kelly would be in for that.
No pizza.
Free dinner.
Actually plate served.
Oh.
No. And then we would have presenters, like a family and a spouse of a paramedic who'd been, at that time, I think, on the job for 25 years, and his spouse would come in.
Yeah.
They'd have a talk. So, I mean, I think there's ways that we can go about working within the
There totally is.
And starting on the front end, whether it's in paramedic schools to introduce boss, and now introduce, hey, do you have a partner or a spouse?
Yeah.
Would you two, or would they be interested in doing this side of the program?
Well, I may have volunteered us for that with an organization that I just spoke to, because he said, we used to.
Ryan, I take it?
No, I started pointing at you. Let the record show. They said the same thing. Like 6 or 8 years ago, they used to have a family recruitment afternoon. Like, they'd come and talk about the job. He's like, I don't know why we stopped doing that. I'm like, well, if you ever need people to come and just free flow with things on family health and systems and boundaries and all that, I'm like, we'll happily do. Like, that's got nothing to do with our Rebuilding Families program. It's just got everything to do with the family system and the importance of that. Yeah.
I have a statement, and then I have one question.
Okay.
The statement is, I've just been listening to you talk about this, and I haven't sort of done this kind of review of this family program really ever since it started. But the reflection is, my God, it takes a long time to build an evidence base.
Yes.
And it's important.
Yes.
But man, does it take time. Do you want to say anything about
that? Besides,
can you keep that in 5 minutes?
Yeah. No, and it's, I mean, here's the tension, is because we know the desperation there is for any materials that are supportive and have any sort of base to them that is that has a grounding or a foundation. So we do, and I've actually talked to some national service agencies. They're like, because I'll tell them we're studying this to then build the evidence for us that means that it might be available for public consumption in a couple of years from now. And they're just like, well, we need it now, and we'll go and find whatever's available out there, which I get that desperation. I really do. But the value of this is that it's not only, because again, I keep coming back to, this was built with and by and in consultation with first responder families. Mm-hmm. And then we add the research and empirical evidence to that. And then you combine those, and what you've got is a product that should give the public great confidence that this is not just something we dreamed up and are selling to make money or commercialize it or whatever, but it does take time to do that. And it is, I feel the same way. I'm just like, oh man, we got another 5 months of delivering this program and collecting data, and then we still got 2 months or 3 months after that before our last group finishes that 3-month follow-up. So I'm just like, yeah, we're ready to get going with this, but it's going to be worth it, I hope. No, it will be.
Totally will be.
It will be.
Yeah, and I mean, the data, the preliminary data is already showing that it is, but I think that's just, I appreciate the additional.
Well, and again, let me pump Boss's tires, because you guys have opened yourself up to the testing of your program, which is not an easy thing to do.
No, Kelly was with us when we were at Simber watching Sean and I digest ourselves as we learned about if
they're listening to the results of this program that they've. Yes.
It's so weird.
Surprise.
Yes. And I think my last question, I don't know if you have the last question, but mine is, so what's next? Like, what's the future for this?
Yeah. So we'll continue to deliver the free program, funded program, until we'll start our last groups in March of 2024.
Okay.
They will continue and finish probably until June, until June of 2024, when we're done our last data collection and follow-up. But we're already starting to build the scalable version of our program. And the uptake right now is really for the self-directed, accessible version that doesn't require a facilitator, doesn't require the mechanics and logistics of that, which we're really happy with, because we want to. The psychoeducation piece for us is really what we've put the most work into. The bonus part is if you have the mutual support and the facilitation to help, but that's the next steps is gather the data, make sure, and again, I say this sort of in jest, but we still want to make sure we're not doing any harm, right? That's the main thing. We're not doing any harm. And then if we're actually able to show and demonstrate that we're doing some positive things and that it's actually leading to good outcomes in the direction that we want them to go, then we will eventually be reapproaching agencies and groups across Canada to say, let's make this widely available for families in your service areas. So that's the next challenge to take on.
Yeah. So knowing full well that this episode probably is going to go in and around the February timeframe,
yes,
give or take a couple weeks or not, we'll see. How can people, if they're interested in actually being a part of your program, how can they access the program?
So we have a website, familyfirstresponder.ca. So you go to that. That's the overarching project. And then one of our tabs on that is the Rebuilding Families program. Click on that. It describes it. So we have a screening form that we ask people who are interested to fill out. And then as long as they meet, like I said, our very basic criteria, then we would contact them and say, here's when the next groups are starting, and we would take them through that process. So if it's coming out in February, there's still a chance that they could connect with this in the weeks following that, for sure.
Amazing. Anything else?
I give you a lot of shit, but I do love working with you.
It's a lot of fun.
And I appreciate what you're doing.
Yeah. Well, and I just appreciate the openness of Wayfound and Boss to a partner, and for you, in particular, giving hours to a project that has taken years off of my life, all of our lives. But we've done really good work, and we have lots to be proud of. And I really look forward to the future, because we are building the track as we go, but we're guided by good principles and good data as we build that track. So thanks to you and Wayfound, and
thanks to you. I mean, as a first responder, I can't think of a better way to actually help the system, the family system. I know I've showed my gratitude towards Megan and the things that she's done within the Boss program and all the offerings that have come out of that. But I think the one piece that I've said for years that's missing is how do we include the families? So from my perspective as a first responder, and I'm not going to speak for everybody, but I think it's pretty translatable across all public safety, is that thank you for looking at and considering that family system. It's who we go home to, and it's who we actually sometimes take the things out of the work that we do. We never have to convince a first responder that family is priority. Like that's a given. So it's an easy sell to talk about this stuff with them. So Amazing. Well, thank you very much.
Thanks for having me. Great to have this chat.
Thank you for tuning in to another episode of the Mental Health Mixtape, brought to you by the Before Operational Stress Program. We hope today's conversation has resonated with you and provided valuable insights into navigating the complexities of mental health. Remember, your well-being is our priority. If you or someone you know could benefit from the support and resources offered by the Before Operational Stress Program, don't hesitate to reach out. Take that first step towards a healthier, more resilient you. And here's a special treat for our dedicated listeners. A 15% discount waits for you when you sign up through the code provided in the show notes. Investing in your mental health has never been more accessible. We appreciate your continued support and commitment to breaking the stigma surrounding mental health. Let's keep the conversation going. And until next time, take care of yourselves and each other.